Hi, I'm Meredith, and I was going to talk to you guys a little bit today about my career profile, and I chose marriage and family therapist. So you would have to have a master's degree to be able to do this career. I looked up, for my example organization, I used Biltmore Psychology and Counseling Center, and that's located in Phoenix, Arizona. It's more of a smaller organization, but I figured that would probably be best for me to kind of get more experience, and so I could be taught more and I could have more flexible hours. For work environment, there are a lot of different places you can work. You can own your own private practice, you can work for a big school, or even a small substance abuse center. So depending on the work environment, it varies between how big you want to work or how small you want to work in location-wise and organization-wise. It's very flexible in that sense. The hours are really flexible too. Generally, you will want to do about 20 to 25 hours a week of counseling. And then so that adds up to 40 to 45 hours total the week, because you need to be doing paperwork after that and all that kind of different stuff. Besides the pay, it's pretty family friendly. The pay is not great, so if you want a huge family, I wouldn't consider this a great occupation for you unless your spouse worked as well. At least to live really comfortably. Like, you could definitely live with a marriage and family therapist degree, but after debt in undergraduate and then graduate programs, unless you have another income, it wouldn't be ideal. The typical stressors, they're pretty obvious actually, because you're going to be working with families who are having lots of issues. So when you're working with these families, there's going to be high levels of stress or depression or anxiety while you're in the room. And at times you might feel their pain, feel the stress, and feel the anxiety or depression they're feeling. And a bunch of counselors struggle with making sure they don't take those stresses home with them, which has been a problem for some people not being very good marriage and family therapists, because they can't separate their work from their home. The typical benefits depend on where you want to work. So if you work in a hospital or a school or a substance abuse center, you generally get pretty good benefits. You'll obviously be provided health and welfare benefits for you and your family, and that includes Medicaid, dental, prescription drugs, preventative care, and mental health services, as well as they do provide retirement programs as well, or retirement plans. But if you own your own private practice, then that can vary on whether you get those things or not. The common job tasks for marriage and family therapists offer guidance to couples, families, and groups who are dealing with issues that affect their mental health and well-being. So they treat many issues within their counseling. They take care of child behavioral problems, grieving, depression, and anxiety, homosexual feelings, domestic violence, infertility, and substance abuse. So you can tell when you think marriage and family therapists, there's actually a lot more than just counseling couples with marriage. It's a more in-depth type counseling. So the different jobs that you would have to do based on what you have to counsel individuals on is observe how people interact within their families, evaluate and resolve relationship problems. You'll need to diagnose and treat psychological disorders within family context, guide clients through transitional crises such as divorce or death, highlight problematic relations or behavioral patterns, and help replace dysfunctional behaviors with healthy alternatives. The educational requirements, obviously you'll need to get an undergraduate degree in something like counseling, psychology, sociology, or social work, or marriage and family studies. For a master's degree, then you'll need to go and get a counseling degree, a marriage and family therapy degree. Most states, after you finish your master's program, they require you to do to complete 2 years of postgraduate supervised work. So it totals between 2,000 to 4,000 hours of clinical experience. And then to officially be able to practice wherever you want, you'll then need to pass a state-recognized exam. So besides that, the salary, the highest paid is over $78,000, and then the lowest earners are about $30,000. That's probably what you're going to get starting out, depending on whether you do really well in an interview or not, or get a good opportunity. For miscellaneous information, I would just say the job growth. There's a lot of job growth in this field. It's expected to grow 19% through 2024. So you'll definitely not be out of a job. I really want to become a marriage and family therapist. That's my end goal for having this degree. Probably once my children are all grown up, that I'll want to go back and get my master's to do this, but marriage and family, it's essential to God's plan, and I would just love to be able to participate in bringing marriages and families back together. So thanks for watching. Bye.